Welcome to everyone. We really appreciate you participating in our Wellness Wednesday. As Caitlin mentioned, I was part of the Joy of Medicine work group, and as part of that, we decided we wanted to talk about topics that were very relevant to us as family physicians and how we've improved our wellness. I think one of the things that was most difficult for me ongoing is when I feel like I'm not having any control over things that are being forced upon me. And a lot of that has to do with regulatory issues. When I first started in practice, and even when I first got involved with the academy, I was not very politically involved at all. What ended up happening was first attending an advocacy workshop and being introduced to legislators. And then, of course, for those of you who are old enough to remember, when 2001 and 9/11 hit and the malpractice insurance market went crazy, one of the things that really affected me personally was the rising cost of malpractice insurance for doing obstetrics, which was a part of my practice that I truly loved. As that continued to get worse, I was forced with the decision to have to give up obstetrics in my practice because I couldn't afford to do it anymore. That is probably the one issue that got me most involved in advocacy. At that time, there was tort reform legislation that was being introduced in the State House, and I testified on that tort reform legislation due to my circumstances that were very relevant to that discussion at the time. What I found was that oftentimes by presenting that information in a very matter-of-fact way, logical information that the legislators could use, it did alter their decision-making process. Sometimes there would only be one or two physicians testifying, and there'd be a whole room full of either patient advocates or other interest groups who would speak. But because we were speaking not only from the heart, but also with a lot of factual information, it really did sway some of the testimony. And we did see some tort reform legislation pass and some stabilization of the markets. That was not only a sense of accomplishment, but it also directly impacted my ability to eventually go back and doing obstetrics in my practice. So I felt like I had a little bit more control over the situation. More recently, one of the things that I testified on, and it took some time, we testified over a period of 3 years and 2 different legislative sessions, but that was with the prior authorization and step therapy bills. I would often get very frustrated in trying to do a prior authorization or having to deal with insurance companies over a step therapy process that sometimes I would have to do over and over and over again, year after year, on the same patient for the same medication. This was not only time consuming, but not what I felt was in the best interest of the patient. So when I was approached about testifying on step therapy legislation, it was very easy for me to provide testimony to speak to these different bills. We did eventually get legislation passed. It didn't have everything in it that we wanted, but there were some provisions that have certainly helped, and I think I have personally seen a difference in how that process works when I do have to make those phone calls. Oftentimes the paperwork itself is a problem, and we don't know what the rules and regulations are for their prior authorizations or their step therapy, and so we're kind of guessing. So part of the legislation was just some transparency, and other parts were actually looking at when patients had already had this done before, not having to redo the same authorizations year after year after year. I don't know about the rest of you, but when I have some sense of control over the situation or feeling like I'm actually actively doing something about a problem, it is a little less stressful for me. And I think that that has brought back a little bit of the joy. It's not always fun to go to the State House and testify. Sometimes you get very difficult questions. Sometimes you have legislators who are not as friendly towards your side of the story. But generally speaking, what I have found is they really are interested in what you have to say and appreciate the fact that you took time out of your busy schedule to come and speak to them. It kind of speaks to how important the issue is when a busy physician actually will take time away to come down to Columbus and speak to the legislators. But you don't have to testify in legislation to do that. You can certainly meet with your legislators in the district and voice your opinions. They often will tell us that one or two or three people speaking to them about a particular issue, they take as an overwhelming majority opinion because so few people take the time out of their schedule to actually contact them about a particular issue. So I've had a lot of assistance from David Paragas and his office, as well as Ann Spicer at OAFP. They are really great at helping us to write up the testimony and know just the process for doing that, and what steps you have to take when you're going to go testify, the forms to fill out, who to contact, etc. So if it's something that you're thinking about doing or interested in doing, there are a lot of resources out there to help you, not only within the Academy offices, but those of us who have also been doing it for a couple of years now can provide some insight and some assistance in how to do that process. So, David, do you have any comments about that?
Yeah, thank you, Dr. Sams. It's always been a real pleasure to work with you on these tough issues, and I can tell you Dr. Sams is well known over in the General Assembly because of her willingness to talk about tough issues and her willingness to testify, but also her willingness to establish relationships and educate legislators. I think all of us who are professionals go into a profession because we are committed to serving others and contributing to the public good. We also want to dedicate ourselves to the use of the knowledge that we achieve in an ethical, fair way to get some just results. But more importantly, one of the hallmarks of professionalism is accepting responsibility for our professional conduct as well as promoting the profession. And I think it's important to note that the nurses have done it better than we have. Nursing school teaches nurses that they must advocate for their profession, not for their patients, but for their profession. And that is a fundamental difference in what we do and what they do in terms of our success in the General Assembly. So what we will oftentimes see is young nurses at the State House, at State House days, who actually have real relationships with legislators. And I think that is a fundamental difference. Many times physicians will ask me, David, how did they do something so stupid? Why did they pass that law? And the only answer I have to give them is, well, because we didn't educate them. They're not experienced enough, meaning legislators, not knowledgeable enough on the technical aspects of the delivery of health care to understand that what they're doing doesn't make sense from a practical standpoint. And so when you go to the General Assembly and talk about issues, I think we look at it from two different perspectives. One, we need to advance and protect the profession. But more importantly, that commitment to serve others means that we're really uniquely situated to be patient advocates. And without us, there really is not an advocate for the patient. And I think that's what characterizes us different or distinguishes us differently from other professions. The experience that I like to tell has really spanned over 20 years. And it's on a single subject matter related again to the nurses. Now, I've been representing the Ohio Academy since 1992, so almost 28 years of lobbying on behalf of the Academy. I can tell you that almost 25 of that has been working directly against or with the nurses, depending on what they want to do with their scope of practice. And about 20 years ago, working with Dr. Welker, Dr. Wexler, and others who are, in the leadership of the Ohio Academy of Family Physicians, we had an initial meeting with the nurses who were then just starting to promote advanced practice nursing, meaning that they were going through the educational track, getting terminal degrees, and expanding their scope of practice in line with that education. What they really wanted was A, independence, and B, the ability to prescribe. And that dates back about 20 years. Other jurisdictions had done that, other states had done that, and they thought Ohio was ripe for that challenge. Well, what we decided to do was to put together a philosophical statement. And the philosophical statement really addressed the educational standards that must be met to be an independent practitioner, the clinical standards that must be met to be an independent practitioner, and finally, the ongoing education that needed to be included to be an independent practitioner. And we threw another piece in there, and that was a written agreement, what we called a collaboration agreement. And you can call independence whatever you want, but without some type of understanding of when your scope of authority ends and a physician starts and who is going to address those transition issues, it doesn't make sense. And we use this with members of the General Assembly all the time to say to them, you don't buy a car without a written agreement. Why would we approach multidisciplinary healthcare without a written agreement so everybody understands what their responsibility is? That position statement, which we put together almost 20 years ago, is just as durable today as it was 20 years ago. And with that, we've been able to go back to that document, make adjustments for advancements in the delivery of a care model, make adjustments as technology changes so that there's a recognition of the ability to communicate both in the hospital setting, an ambulatory surgery setting, or physician's offices, or in a rural clinic, so that that relationship between the physician who is collaborating with an advanced practice nurse and now PAs and other allied healthcare providers has some meaning and there's an understanding. Now, last year, the advanced practice nurses have really taken it to the next level, and they have introduced legislation that would abrogate that collaboration agreement, terminate the requirement that that be in place. So they're really going after independent practice. Well, as I know, having worked with physicians for the last 27 years on this, that really can affect your well-being because it does impact how you will practice. And to me, at least the feedback that I'm getting from physicians who work day in and day out with other mid-level providers is not something that they're driving, but rather something that is being driven by the leadership of the nursing organizations. And so when you look at that issue, it continues to evolve. We've had a philosophical statement that has been in place that we can go back to, but the most important piece of it is a consistent message that each one of our physicians has been able to deliver to legislators as they have negotiated on this bill. And so it gives us a comfort zone to work from, a philosophical statement that we can point to and say, hey, these are the principles that we stand for, and gives legislators the information they need to make informed decisions. So it really is something that's worked well. Obviously, we're going to have to continue to develop that statement as practice changes, as we advance into telemedicine, and as we advance into different delivery models based upon reimbursement. But that's just one example of how we've kept our control over how healthcare is delivered in a way that balances our needs to understand how multidisciplinary practice will occur, but more importantly, it helps us really put the patient's outcomes at the forefront of the discussion. And so that's an example that I regularly use as we talk about why it's important to advocate and what tools you'll need to be effective in that advocacy. Sarah, did you have anything to add to that?
Yeah, first of all, I apologize. We've got automatic lights. If I don't move often enough, they go off. Yeah, I think one of the important things that we have always tried to do as an academy and people testifying on behalf of the academy is really focus on the patient and how this affects the patient and not so much about ourselves. a lot of people will go before the legislature and are really focusing their discussion on how it affects them and their specific practice of medicine. And most of our testimony really focuses on how it affects our patients. And we've really tried to keep that in the forefront of our messages. And I think that resonates really well with the legislators. They are really interested in their constituents and how this affects their constituency, as opposed to kind of the money-grubbing physician who has a turf war with another group of physicians. We try and give them the information on how this directly or indirectly will affect our patients and what that means for patient safety, as well as cost of care, and total cost of care.
I'd like to add another discussion point to our presentation today, and that's the importance of relationships. I'm sure Dr. Sams will tell you how she's developed relationships with even some of her adversaries, but I know that Congressman Steve Stivers calls her on a regular basis and say, hey, I need your input on this healthcare legislation that's pending in Congress. Well, it wasn't just because he heard her testify just once. It's because Dr. Sams has taken the time to have Congressman Stivers out to her facilities. She has taken time to respond to his questions and do some ad hoc research for him when he had some issues that he really didn't understand and needed some real advice on. But that was part of developing the relationship. And I think she would share with you that that has been a very fruitful relationship over the years and has constant, repayment opportunities. And I don't mean that in an appropriate way, but has really been beneficial not only to family practice, but more importantly to our patients. Dr. Sams, do you want to talk a little bit about how you established that relationship?
Yeah, I'd love to. One of the things that I mentioned at the very beginning was that I attended a legislative reception that we had through the Ohio Academy that we used to have every other year, where we met with our state legislators. And the first time I went to that, Randy Wexler, who was sort of my mentor guru in advocacy, said to me, these people are just real people just like you. They have a job to do and they don't know healthcare, and it's your job to educate them. So just get to know them. I met at that time my state representative, who was Larry Wolpert, who was new into the state legislature, and just went up and said, hi, I'm, in your district, and I'm a physician, and talked to him. And then I said, who's your physician? He said, well, my physician retired a couple of years ago, and I really haven't had one. And I said, well, everybody deserves a family physician. I handed him my business card. And a couple months later, he showed up in my office as a patient. So we had a lot of discussions over the years of him being my patient. When he'd come in for an office visit, we'd talk some politics. I'd go to his office to talk politics. We'd talk medicine. So that really developed. And he has contacted me even since he's been out of the legislature. Way, way back, Cheryl Grossman, before she was mayor of Grove City, I actually got a kitten from her when I was in residency. And that started a relationship such that when she was mayor of Grove City and my office was in Grove City, we had some discussion. She then became a state representative, and I worked with her on a lot of legislation. Steve Stivers authored several of the tort reform legislations that I initially testified on, and that's where I got to know him. So people who start in the State House oftentimes end up in our national legislature as well, and that's a good way to start those relationships. I have developed an ongoing relationship with Congressman Stivers, such that, as David mentioned, he will contact me. As a matter of fact, I was in a faculty meeting about a month ago and had scheduled an appointment to meet with him in a couple of weeks while they were on break for summer session. And my phone started blowing up, and he was supposed to go out of town for something for the legislature and had a flight change and was unable to go out of town. So he had no appointments that day, and his office called and said, he's got all this free time. Do you have time to meet with him? I said, sure, as long as he can come to me, because I'm doing faculty stuff today. So he came down to our office downtown and spent 90 minutes touring our facility, looking at our walk-in care center, learning about our addiction medicine program. And that was completely initiated by him. And so while we don't always agree on every vote and every issue, he truly does listen to what I have to say. I've been to some political fundraisers where he's been talking, and he will directly spout the information that we have provided to him in front of people that are from not necessarily even medical fields. I went to one fundraiser that had to do with mostly business people. I was one of the few physicians in the room, and the first topic he brought up was healthcare and healthcare legislation, and talked about various things. And then when they opened it up for questions, no one else was speaking yet, and so we had a direct dialogue about some specific bills that were in Congress at the time. So I do feel like that ongoing relationship has really benefited not only me personally and our profession, but the academy, in that if we really need to get to somebody, I can call him directly. I have his cell phone number. I have his staff members' cell phone numbers. So I don't just have to go through their district office. I can actually call him, and we can have some conversation about whatever's going on.
Yeah, thank you, Dr. Sams. I think one of the things that I will continue to emphasize is the importance of the relationship, and I think you've heard firsthand how it's really helped Dr. Sams. You know, the other piece that I really want to emphasize is that we do have an obligation to talk about issues broader than those that only impact family medicine. And let me give you an example. I mean, you know, the General Assembly considers over a 2-year period in Ohio about 800 to 1,000 bills. 25% of those are related to health care. And in one of the ongoing crises that we have in our country related to vaping, you know, they were looking for support on raising the age to 21 and banning flavors. Well, you know, they came to the Ohio Academy of Family Physicians for our support first, because they knew that we could provide them the medical expertise, an appreciation on how to move legislation forward, and the grassroots support to get it done. So we worked directly with the governor's office this year in crafting a proposal that would raise not only the smoking age to 21, but the vaping age to 21. And we weren't successful immediately with banning flavors, but I think we're going to get there, in part because of our involvement. And organized medicine as a whole said, okay, this does impact our patients. Is it directly related to family medicine, our reimbursement issues, our liability issues? No, but it is an important issue for our patients, and so we need to be involved in that. And so we were the very first organization to pass a resolution supporting raising the smoking age to 21 and the vaping age to 21 in Ohio. And as a result of that, legislators reached out to us, not because they saw, oh, Ohio Academy of Family Physicians, I need to identify that family physician. That's because they knew us, and they knew who to reach out to. And I'm sure many of our members got individual calls on questions of, well, you know, who are we going to punish if we do this? Is this, you know, what's going to happen to those adult smokers who've gone to vaping to get off of cigarettes? And we were able to fire back, hey, it may have been an off-ramp for adult smokers, an off-ramp from smoking, but it's an on-ramp for young people, and we want to avoid both. So, you know, so that's another case example of how our relationships have really benefited our patients and, you know, really added to population health management in the state of Ohio.
And I think also one of the other advantages is once you've developed that relationship, you can talk about topics that are not specific family medicine topics, and you have a credibility with that legislator. They know that you aren't just a one-issue person, and that you are looking at the benefit of all people in their constituency. So you know, if you have other personal issues that you want to talk to them about that may not be directly family medicine related, they're going to listen to you a little bit more than they might someone else, just because they know you and they know that you have integrity, and that you're not just kind of going off on a particular topic. So I think that relationship issue is a very important part.
Yeah, and I think, you know, there are some management issues, the management of your practice issues that we are constantly involved in. So the big piece of it is, how do you manage payers? The bureaucracy that they make physicians go through for prior authorizations, step therapy, as Dr. Sams talked about, but just the real, you know, basic issues like HIPAA compliance. How do we work with policymakers on those tough issues? And recently, we had a provision for those organizations that are formed in pass-through organizations, so limited liability partnerships, limited liability companies, and they wanted to eliminate a deduction for those entities, physicians, lawyers, accountants, all in the same pool. Well, they decided to pick on lawyers and lobbyists in that and left everyone else alone because they didn't want to hurt physicians in that mix. And part of that was because of our advocacy saying, hey, listen, physicians are only getting a portion of their bills paid. Their usual and customary cost is really much higher than what they're getting paid by third-party payers. If you're going to now tax that again, you know, that's even going to cut into more into their ability to deliver health care. So they left them harmless and went after the lawyers and the lobbyists, which didn't make anybody unhappy.
So Caitlin, do we have any questions that people want to share with us?
I don't see any now. If anyone has questions, use the chat function. I'm going to move everybody over. So if you have a camera, you can be on video. If you have a microphone, you can ask questions. We'll kind of open it up for some dialogue here. Got a few people on with us today. And then as everyone's getting switched over, maybe just kind of breaking it down. What's kind of a first step if even testifying seems maybe a little advanced for someone? Are there smaller steps you can take? I know we send out a lot from the Academy speak outs. Is that something like just reply to that, or kind of what's a good first step?
Yeah, I think there are several different options. Speak Out is something that is so easy to use. It's a already typed up message that has all the important points that the Academy wants to make. You can send that verbatim, or you can edit it to add personal stories or just make it a little bit more your own. That's something you can do online. You can certainly schedule appointments with your legislators. If that seems intimidating, there are many of us who would be more than willing to go with you on that first meeting if we're in the area. So that's a nice step. The American Academy of Family Physicians has its Family Medicine Advocacy Summit every year, usually in May, where we go to Washington, D.C. and do education on Monday, and then on Tuesday do Hill visits, and those are done in groups with other members from your state chapter. So there's someone there who has experience who can help you. And that's a good way to get started as well and have some mentorship. I think it's great to have new people with new stories. Sometimes they get tired of hearing from those of us who have been there several times, especially if the topics are the same. But we have had some very timely interaction with medical students and residents who have gone with us, and happened to be, we had a resident from Toledo that was with us when Flower Family Practice residency was being shut down. And so he was able to provide some immediate feedback to our senators regarding that and take some action. So it's really great to have different voices when we do those Hill visits as well. So.
Yep. The other thing that I suggest to folks is, start out easy. reach out to your state legislator. It's very easy to find. If you go into ohiolegislature.gov, there'll be a tool within that, and I know Speak Out does this as well, that will help you identify with your zip code who your state legislators are, whether it's state senate, state senator. And if there's something that is pending, send them an email and say, hey, I'm interested in discussing this issue with you. Would you have time for a cup of coffee? If you're not as comfortable meeting with them face-to-face as the initial part, then send them an email and say, here's what I think about this. Let me know if you have any questions. We'd be happy to talk to you. 9 times out of 10, they're going to call you back, or somebody in their office will call you back and start that first part of the relationship. It's really easy to do. Remember, these folks who are running for office, they like people. They're people. And so they're going to get back to you and talk to you about these issues. And I've very rarely had a legislator not reach back out to somebody and start a dialogue. So it's pretty easy to start that. As it relates to testimony, the one thing that I always admonish folks to do is before you testify, read the bill. Understand really what's in it. Don't rely on the updates that have been provided to you by OSMA or OAFP. There are nuances that you will pick up, and if you focus only on the negative parts of the piece of legislation, those that you're challenged with, you may get a question on something else that you're just unfamiliar with. And the last thing I want a legislator to walk away with is the impression that you haven't read the bill. The second part of it is when you prepare your written testimony, brief is better. And I say brief, 3 minutes. It forces you to really say, here's my position in the bill, here are my concerns with it, and here's how it can be improved. If you put those 3 elements in testimony, it'll be very meaningful for legislators and understand exactly where you stand on the bill, where there are some challenges and why, and then how you would improve it. I think it's always best to tell people, yes, we don't like what you've done, but we think it can be improved by doing this. And then the final piece of it is follow up, follow up, follow up. If you're going to testify and you get some questions that you can't answer, then follow up with that legislator or the committee and say, I've done some research. Here's the answer you were looking for. Here is my response. And then follow up with them to say, is there anything else I can do to help? If you do those things in that order, I think that's a very successful encounter with the members of the committee.
I think the other thing that I will do sometimes is paying attention to legislation, not necessarily ones I've testified on, but I will see how my legislators vote. And if they vote in a way that is favorable to what I would want them to do, I just send them a thank you note saying, I appreciate your consideration of this. If they vote in the opposite way, I might point out to them some of the reasons that this may be difficult or how it might affect people that they weren't aware of. But I will oftentimes just send a nice little brief thank you note saying I appreciate, especially if they went out on a limb and voted maybe against the way the majority of their party voted, because not everybody votes party line. Some of them actually do think about issues, and when they take a risk and vote against something that their party was supporting, or they vote for something their party wasn't supporting, and it benefits our discussion, I'll try to connect with them on that as well.
Great, thank you. I will throw in here too, the OAFP's website has a ton of resources and great ways that you can get started. There's a Be Your Own Advocate page. There's talking points, statements, any current legislative or regulatory issues are always updated there. So definitely be sure to check that out too. And then we also have a public policy committee that Dr. Sams chairs. Our next meeting is actually coming up this weekend, but we hold those usually quarterly. So that's another great way to maybe get involved or at least hear from your peers what's going on before you want to take any other kind of big step. But you're amongst friends and talking about all the issues going on. So another great, I think David attends those as well. So another good opportunity to kind of get your feet wet in this arena. I don't see any other questions. I had one more that I had kind of prepared if you'd like to touch on. A lot of times I hear from students and residents, they're not sure if they should even get involved in this kind of thing. Do the legislators really want to hear from them? Is what they have to say valuable? Can you touch on that? Because I mean, I think it is very valuable and that they should, but kind of explaining why.
Yeah, you know, there are obviously some specific issues that directly impact students and residents, like graduate medical education funding, student loan repayment, liability, certainly business practices. So they do have some very specific examples and stories. You know, looking back 20 plus years ago to when I was in medical school and medical school debt, my stories have almost no impact compared to the stories that the current students and residents have about the kind of debt that they're incurring in order to practice medicine, and why people aren't wanting to choose medicine, or why they might not choose primary care. Sorry. So having them be able to speak directly is very helpful. We actually started an area of concentration and advocacy in our residency program in order to train residents specifically on how to do advocacy. So it's something that they can choose to be a part of during their second and third year if they want to do so. So we take them along with us on Hill visits. If I'm testifying on legislation, I usually ask if anybody wants to go with me so they can observe. We did have one of our area of concentration residents actually do testimony on a vaccine bill, and I was there with him. He did a great job with the testimony. When it got to the question and answer period, there were some places he got stumped, and I just stood up and asked the committee if it was okay if I assisted him in answering, and they were gracious enough to do that, again, partially because they knew who I was and there was that familiarity. And so we were able to kind of tag team on the question part. So yeah, absolutely, students and residents should get involved.
Yeah, and I'll just augment that by saying it does really matter to legislators, because we have two physicians in the General Assembly right now, both board certified in family medicine. Dr. Terry Johnson, who taught at OU, and we have Dr. Steve Huffman, who is board certified in family medicine, but is practicing ER medicine right now because it works with his legislative schedule a little bit better. But you know, other than that, the other 130 or 129 members aren't physicians. And so they're generalists. And while most of them understand business issues, they don't understand healthcare delivery issues. And so input, you know, even at a resident stage, because you're on the front lines as a resident, hearing firsthand how potential legislation will impact not only your education, your clinical education, but the delivery of care is vitally important, because these folks have never had an encounter like a young resident has. And so I think it's really important for folks to reach out and talk about that experience. It's important to legislators, but it's important to the profession as well.
And didn't we also just get a pediatrician elected? Am I remembering correctly?
Oh, that's correct. Yes, we do have a pediatrician from Columbus. Yep.
Yeah.
Yep.
And so the nice thing with that as well is we have some residents who may be wanting to run for office in a few years after they've completed everything. So getting their feet wet and seeing other legislators who are physicians gives them a little bit more incentive to potentially do that as well.
Awesome. Do you guys have any other ending points that you want to make? If not, I think we'll wrap this up a few minutes early. I'll have a couple of housekeeping announcements to finish us off, but I don't see any other questions, so.
I would just say, again, I think what has helped me the most in this is just feeling like I have a little bit more control over a problem, not feeling quite so helpless. It doesn't always go the way we want it. Not all legislation that we want passed gets passed. Not all legislation that we want shot down gets shot down. A lot of times there's compromise that we get part of what we want. But at least it feels like you're doing something about it and not just sitting back and having it done to you. And I just want to thank David because, again, he's been lobbying on behalf of Ohio Academy of Family Physicians since the beginning of his career. And while I know he could move on to bigger and better things, he's kind of a part of our family now. So we really appreciate all that he has done for us and all that he's done to educate us over the years.
Well, Sarah, thanks. And I do really love my family doc, so it's an easy engagement.